Hello, I'm attorney Anita DeCarlo from the Inc. Law Office, and we're here today to discuss COVID-19 and the Illinois Workers' Compensation Commission. We're going to start by discussing a recent amendment to the Illinois Occupational Disease Act, where the legislature added Section G to the pre-existing Section 1. This came into effect at the end of May through the agreed bill process, and it's designed to protect any COVID-19 first responder or frontline worker by creating a rebuttable presumption that the individual's exposure arises out of and in the course of their employment, and a separate rebuttable presumption that the individual's condition is causally related to that employment. This rebuttable presumption covers all of the people identified in the Governor's Executive Order 2020-10, specifically first responders and frontline workers are identified. The police and fire for the city of Chicago are going to be exempted because they're already exempted under Section 1B of the Illinois Workers' Compensation Act, but all other fire and police will be covered. It also covers EMTs and paramedics, healthcare providers engaged in patient care, so this would include doctors, nurses, janitorial staff, basically anybody who's working with patients, corrections officers, grocery stores and pharmacies, food, beverage, and cannabis production, agriculture, charitable and social services, gas station and transportation, financial institutions, hardware and supply stores, critical trades, including electricians, plumbers, construction workers, mail and post. Of course, U.S. mail is exempted because they are covered by the Federal Employee Compensation Act. Delivery and pickup services, educational institutions, laundry, restaurants, supplies to work from home, supplies for essential services, transportation, etc. Basically, if you're working during this time period, you're going to be covered. And so the legislature worked very hard through an agreed bill process to make sure that as many people are covered as possible during this time. The rebuttable presumption applies to all cases tried after the effective date of the amendment, which is the end of May 2020. And it applies for diagnoses made after March 9th of 2020 through December 31st of 2020. Obviously, the legislature may extend this if they deem it appropriate. For diagnoses made on or before June 15th of 2020, the petitioner can prove the positive result in three ways. One is a diagnosis by a medical provider, or a positive test result being a lab test for COVID or an antibody test for COVID. For any cases, any diagnoses after June 15th of 2020, only a lab result, being the COVID test or the antibody test, will be accepted. They're no longer accepting the doctor's diagnoses, as it appears that the testing is more readily available. There are three exceptions to the rebuttable presumption. The work must require that the worker be exposed to members of the general public. Number two would be that the work must expose you to over 15 coworkers. And number three would be an employee's home is not considered a place of employment unless they are a home healthcare worker. The employer can rebut this presumption in one of three ways. The first is if the employee was working from home for 14 days or longer prior to their diagnoses. The second is if the employer can prove that the employee was exposed by an alternate source. And the third one I'm going to read because it's pretty interesting. The employer can present evidence that they were engaging in and applying to the fullest extent possible or enforcing to the best of its ability industry-specific workplace sanitation, social distancing, and health and safety practices based on updated guidance issued by the Centers for Disease Control and Prevention, or the Illinois Department of Public Health, or was using a combination of administrative controls, engineering controls, or personal protective equipment to reduce the transmission of COVID-19 to all employees for at least 14 consecutive days prior to the employee's injury, occupational disease, or period of incapacity resulting from exposure to COVID-19. So it appears that employers are going to argue that they did everything that they could to protect the employee. And of course, our employees are going to be arguing that the employers had some type of a defect in in how they were attempting to protect the employees. The last item addressed is credit. Obviously, all credits allowed under the Illinois Workers' Compensation Act are still available. In addition, the employer will get credit for any sick leave. They are also entitled to credit for extended salary benefits paid under the Emergency Family Leave Expansion Act, the Emergency Paid Sick Leave Act, Families First Coronavirus Response Act, or any other federal law. The date of accident is also addressed. The date of accident is either going to be the first date the employee was unable to work due to a diagnosis, so possibly the day that you were told to quarantine after you were diagnosed, or the other date can be the first date that the employee exhibited symptoms requiring them to miss time from work. The last item to be addressed is credit. The employer, of course, is entitled to any credits that they would previously be entitled to under the Illinois Workers' Compensation Act, which of course would include sick leave. And it's also including extended salary benefits paid under the Emergency Family Medical Leave Expansion Act, the Emergency Paid Sick Leave Act, the Families First Coronavirus Response Act, or any other federal law. So if you're an experienced ISBA workers' compensation attorney, this shifting burden appears to apply to anybody being exposed to the virus to a greater degree than the general public. This is a standard that we know well. The Illinois Workers' Compensation Commission is currently going through a lot of changes, as all other areas of law. We are performing our status calls and pretrials through WebEx, and currently all settlement contracts are being presented online, with the exception of pro se. If you do not regularly practice in the field of workers' compensation, you may want to consult with an ISBA workers' compensation attorney who is constantly being updated on the newest procedures and rules during this unprecedented time. The takeaway here is, if you are an attorney receiving a call from someone injured on the front lines, there may be a compensable injury that previously was not. So make sure that you're consulting with an ISBA workers' comp attorney if you're not experienced in this field. Thank you for listening.